Okay, namaste. I am Dr.Arun. I am the president of Nepal Pediatric Society since 2023 June, and I am leading the organization of all pediatricians in Nepal. Actually, the registered pediatricians in NEPAS, those who are members, are 703 till date, but many have not registered, so must be around 800, 850 if we consider that. But some are outside the country also, so the working pediatrician would be around 500. So as you know, you and some of your friends and we have met couple of times before this in the last 1 year, and Nepal Pediatric Society was looking for some ways where we could get the neonatal resuscitation protocol trainings for trainers and for providers. And these days, as per the medical education, any training is started or initiated from simulation. So when we had a talk with you and when you showed us the demonstration, we were very excited and we were very positive regarding this neonatal resuscitation part. And the simulation part, which was very interesting and very effective, and it was the instructions given in that were easy to follow. So there are a lot of positive parts in this program, and what feedback that I've got from my friends is that uh, it's a accredited sort of a course in terms of say the Japanese Pediatric Society or the Japanese pediatricians who follow the same thing, and it has no strict copyrights, so we can also use it openly. So that's what we were looking for, compared to other courses which are very expensive for a country like Nepal, and being expensive, a lot of people cannot take this course. So yours was one of the positive parts, was the copyright part also, and because of that, people are also very excited to get this done in other parts of the country and with many more pediatricians. So that's it. We are very positive that this will continue, and we will be able to disseminate this in the larger society also. Thank you. We definitely welcome your collaboration. We definitely appreciate the help that you have been providing. And Nepal Pediatric Society, NEPAS, is very much positive in this, and we expect these collaborations, these trainings, and these friendship things to be long term. And we would also like to hear from others that this course has really changed the whole course of neonatal practice in Nepal in terms of saving lives, say the neonatal mortality uh, of Nepal. The neonatal mortality of Nepal is 21 these days. Now, as per the SDGs, Sustainable Development Goals, it has to come down drastically up to 12. Now, getting this down to 12 or 10 is a mammoth task. And what we feel, the members of Nepal Pediatric Society, what we feel is neonatal resuscitation is one of the factors through which we can bring down the neonatal mortality to a certain extent. So, in that aspect, since we are professionals, we are specialists, and there are neonatologists who are more specialized than a pediatrician. Whenever a baby is received in a secondary or a tertiary care center, we would be able to confidently practice this neonatal resuscitation and save more lives in the future, which will add up to contributing to the national goal as a whole. Whenever there's a leader or as a president, What I feel is I have got a big responsibility. It's not a responsibility that I have been practicing or I've had in the past. What I mean is the responsibility of 700 pediatricians who are looking after the health of children of Nepal. So, what I feel is we should be the custodians of child health in Nepal. And there are so many supporting organizations, the Ministry of Health and Population, where there are various sections, departments where they look after child health and neonatal health, mother's health, and all that. But what we feel is up to a certain level, in a community level, the primary care level uh, is done by uh, people who are not pediatricians. And they have done a tremendous, fabulous job till now over the last 20 years, last 2, 3 decades. They are the ones who have looked after the children and brought us to this stage. But now, from a certain stage, they have limited knowledge, they have limited skill. What I feel is the pediatricians are the ones now who have to take over the secondary and the tertiary stage management of children. And what by that it means that it is a specialized care, it's a super specialty care. Neonatology is a big subject, especially if we are talking in terms of these projects which we are doing right now with you all. Uh, Similarly, we work through these chapters: the neonatology chapter, the cardiology chapter, nephrology chapter, and we have around 14 chapters with members, quite a lot of members in each. They have their own activities, and as a whole, our aim is just to make sure that the health of children of Nepal is taken care of whenever they are brought to a pediatrician. So if we take it in a broader sense, it is a big responsibility. But I have tremendous people who are excellent in their jobs. They are hardworking, sincere, and voluntarily they come and work at times of need, at times of disasters, pandemics, or any other issues that relate to the health of children. So overall, I'm enjoying my job. I'm a retired military doctor. As a pediatrician, I have worked there for 3 decades. But this time now, when I'm out in the community, I know my job, I know my responsibility, and I will make sure that things are done. So I'm very positive about the society, Nepal Pediatric Society, my team members, my colleagues, and people like you who are supporting us, the ASHA, the Ministry of Health, and many more. Which there are so many names that are important to us in our working. So that's it. So I hope you all also enjoyed the stay. You all enjoyed the training with people from my society, and I look forward for many more collaborations in the future.
Thank you very
Right.
much.